Monday morning, everyone, and welcome to Connections Online Studio and to our live chat. And I'm Nat, Connections Director of Communications and Outreach. And this morning, I am thrilled to welcome Sifuni Kajiru, who is a two-time recipient of our bursary program. So welcome, Sifuni. Thank you so much for joining us this morning.
Thank you.
So basically, I thought that we could go over what the bursary is for everyone. And then afterwards, me and Sifuni will be chatting about her experiences and whatnot. So quickly about the Connections Health and Social Services Community Leadership Bursary Program. So this is a financial incentive for students with English and French language skills who are in the Outaouais region. So they're pursuing full-time studies in health and social services at a Quebec government recognized institution. And students who are studying within or even outside of the region can get up to $10,000 a year, and they can apply multiple years. So as part of this bursary program, it's a retention type of program. The student, after they're done their studies, would come back within the Outaouais region and they would complete a year of work. So just so everyone knows, I've included the link for more information. We're actually going to have a call for applications this spring. So if you're looking to study in the field of health and social services, going to a CEGEP, a college, university, make sure to check us out. Make sure to call us, contact us if you have any questions. So Sifuni, I thought we could talk, first of all, we could start by talking about how you got here. So after high school, what did you do?
Yeah, so after high school, I did 2 years of science nat, like natural sciences, and I ended up actually switching to nursing in CEGEP, which was 3 years. So after the 3 years of CEGEP, I ended up applying to McGill University, and I've been doing that for the past 2 years.
And from what I understand, you're actually almost done. So you've got one more month of schooling and then you graduate and you're done.
Yeah, and I'm done. I'll have my bachelor's degree in nursing finally.
Oh, that's awesome. Congratulations. It must have been quite the journey, but a really amazing one as well.
Yeah.
So I'm just going through my little list of questions here. And I just quickly wanted to know, how did you hear about our bursary program?
Yeah, so I think one of someone from the Connections department, like from your organization, passed by in one of my classes and talked to us about the bursary. Well, that was pre-COVID, so I mean, people came and talked to us about it. So it was pretty amazing because I hadn't heard about it before. And I remember we got like pamphlets and the link as we're getting right now, and I applied after.
Yeah, and I think you had said that you went to Heritage College, and that's where you'd heard about us.
Yeah, I went to Heritage College.
Yeah, we actually do. Well, with COVID now, it's a little more difficult, but we used to go in the high schools and talk to like the grade 10, 11 students. And Heritage College, of course, we have a really great partnership with them. So yeah, we used to go in the classroom and whatnot and talk to students. So, and in terms of doing the, all the paperwork and all that, how did you find it? Was it pretty simple to do, or?
I thought it was pretty straightforward because I think we had a checklist in the documents. So as long as I followed the checklist, I was sure I had everything in. And the people were really approachable in answering questions that I had. So it was really straightforward and easy to do. I don't think I had trouble any of the 2 times that I did apply. I don't remember having trouble applying.
Yeah, and that's a great thing. A lot of people, or a lot of students, I should say, don't realize that you can actually apply multiple times for this bursary, which you've done. So you've actually received it twice. You've won it twice. Yeah. It must have been really helpful for you, going through school and whatnot and having this bursary to support you.
Oh, yeah, it was pretty amazing because what ended up happening is I ended up studying during the COVID pandemic for the past years. It was a little bit complicated because now I was obligated to work more as a nurse, and at the same time I was obligated to go to school sometimes despite it being COVID. So I ended up getting 2 apartments, having to pay for 2 apartments. So having that extra like help, that extra question was really appreciated, and it ended up like having a huge impact in what I could actually achieve, and like it relieved a lot of stress that way. So I really appreciate getting it twice.
Twice, yeah, for sure. And yeah, I can see it helping because, well, you did work during your bursary. So you were working here in the Outaouais, if I understand correctly.
Yeah.
And then you would go to McGill in Montreal to
Every
do
week.
studies every week. That must have been crazy.
That was crazy.
But I can imagine if you had to then also pay like for your full-time studies, you would have had like, it would have been exhausting, like beyond exhausting, right?
Yeah, so the bursary does end up covering your school, does end up covering your costs. So it does like have a huge impact if, especially if you're living alone. Well, even if you're not living alone, it's still a sum of money that could make an impact in someone's life. So
for sure, yeah, for sure. So you haven't quite completed your studies yet, but as part of the bursary, you're actually going to be, well, you have to do 2 years, right? I'm guessing you have to come back and complete
a year for bursary. Yeah.
Yeah. But you're actually already working here in the Outaouais. What are you doing here in the Outaouais?
I'm working as a nurse on a cardiology floor in the Hall Hospital. So I've been working there for well, after my CJEP, I did take a year off. So I did work there for a year, and then I applied for the bursary to do my schooling. To be able to keep my job at the Hall Hospital, I had to work for some time while doing school. So I've been working on the cardiology floor for the past year and a half.
And are you enjoying it?
I love it. I think that's where I'll be staying for quite some time.
So you coming back and working for the 2 years, so you'll be staying on then in the Outaouais, basically.
Yeah.
Oh, that's awesome. That's awesome. Because as you know, we really do have a hard time, finding, staff, right, in the health and social services in the Outaouais. It's really difficult. So when we hear from students like you who are coming back within the region and who'll be staying long term, it's really nice to hear. We love when our students come back. And as well, I'm sure that you also love the community here in the Outaouais.
Yeah, it's amazing.
So you had mentioned something which I thought was really, really interesting. As you know, we have been having a hard time retaining people here in the Outaouais because a lot of, whether you're working in nursing or as a doctor or whatnot, in health and social services field, a lot of people end up either working in Ottawa or maybe even Montreal because, sometimes the salary is a little bit more. But you were actually saying that in the last year, I think, that because of the new prime or bonuses, I guess, that you're actually making more than nurses who are working in Ottawa and Montreal, for example.
Yeah, that's what's been happening because of the new incentives that the government put. We're not sure how long the incentives would be, but like it's it does make a difference. So on my unit, for example, we've had 2 nurses who went to Ottawa and they're back because now they're closer to home, and with the bonuses added in right now, and the prime that they added in evening shifts, night shifts, I don't know. There's a lot of different incentives that were added in that actually end up getting us paid more than people who work in Ottawa. So if it's salary right now, then that won't be an issue anymore.
Yeah, and that's great news. And hopefully they do keep those bonuses or prime, as they call them, on for long term, because I think it is important that our nurses and that all of the people within health and social services get a salary that, that is similar, if not better than in Ottawa, so that we can keep our students here and keep our people here. And it's great as well that you're bilingual because you're able to support, people who are French speaking or English speaking within the region. So that's also really great.
Yeah.
Yeah.
We need more English speakers because, for example, in my unit, we work closely with Civic because we have a lot of patients that go to Civic for like open heart surgery. So we do have to communicate with a lot of some English skills there. And even with some patients, like some patients need someone who speaks English, so we need a lot more nurses who are bilingual in Quebec hospitals as well. So retaining those here is amazing.
Yeah, and I think that's why I love this bursary so much, is because it has all of this, right? Like it supports our students that are here in the Outaouais. It allows them to study outside of the Outaouais or in the Outaouais. It's really their choice, which is a bonus. But it also brings them back to come work within their community. And a lot of them want to come back because this is where their friends are, their family are, you know, so they're happy to, you know, to do that year or whatnot that they have to do. And then of course, yeah, speaking bilingual is just another huge bonus for us as well. I'm just taking a quick look at some of the people, our viewers, and just to say hi to everyone. So we have Sarah, who is just saying good morning. I'm looking forward to hear more about the bursary program. And like I said earlier as well, for anyone who's interested, we are going to be doing a call soon. It's usually around April, May. So make sure to check out our website. And Sarah says, yes, it's so important to love our jobs. That's for sure, for sure. And Danielle is here as well. She's saying hi, Nat and Sifuni. And we have Deborah as well. Thank you to all the nurses who work here. Yes, a huge thank you for sure. Thanks so much, everyone, for joining us. This is great. And if anyone has any questions, please type them up in the comments, and I'm sure we'd be more than happy to answer those. So yeah, thanks so much, Sifuni. This is really great. I heard as well that you were quite busy this weekend. So
yeah,
shifts. It's really nice of you to join us this morning.
My pleasure. Anytime.
For sure. All right. Well, why don't we wait just a few seconds to see if anyone has any questions or anything like that to ask us. If there's any students out there who are looking for information or who'd like to know more from Sifuni, please go ahead and ask those questions, or you can contact us as well by phone or by email and check out our website. Oh, and here's Paul as well. Oh, hi, Paul. How are you? He's saying thank you.
No problem.
So 1 more month to go. You must be really excited. And once you're graduated, will you be staying on the cardiology unit as in Hull, right? I think you had said at the
yeah, Hull. In Hull. So I'll be staying on the cardiology unit in Hull. Maybe do my master's later on. We'll see. I'm planning maybe on doing my master's as a nurse practitioner, because now you could even do be a nurse practitioner in cardiology, which is amazing. So I could maybe look into that later, but I'll take a break from school for a couple years.
Well, when you do your master's, you'll have to make sure to come back to us and reapply again for a bursary, because we would be more than happy to help you out. That would be awesome.
That would be awesome.
Oh, Sarah is just asking what information is required to fill out the application. I think there's quite a bit of information that's required, right, Sifuni?
Yeah, I remember. I think you had to. It's been quite some time, but I think you have to put your CV, your grades,
yeah,
and.
I'm just looking now.
I think you have to fill out the form, put your CV and your grades. I think that was it.
And I think as well that we do check for like, I'm just going to put the link right here for the bursary program so people can go look, because we have the older application form there. We won't have the new one until the call out happens in the spring. But we do have the older one if anyone wants to take a look. Oh, and it's in French and in English as well. But yeah, I think the grades, your work experience. Oh yeah, 2 references as well. Thank you. That's true. You do need 2 references as well. And we have a quick
letter of acceptance that you were accepted in the program that you applied to.
Yeah, yeah. But the process is pretty simple, and the fact that you filled it out twice is awesome. And hopefully, you know, if you do end up doing pursuing a master's, you'll be able to put your name in again. So that's always a plus. All right. Well, Sifuni, again, I wanted to thank you so much for joining us this morning. I really appreciate this. It's really great to spread the word so that other students have the same opportunity. And of course, to keep you within the region. And yeah, students can definitely call us to get help with the application. We are always here. I made sure to put a link in as well for the bursary program. And yeah, so a huge thank you to everyone out there as well. Thank you again, Sifuni. And I guess, oh, we have someone who'll be coming. Michelle will be joining us again tomorrow morning at 9 a.m. So make sure to drop by and have a lovely, lovely week, everyone. Thanks, everyone. Have a wonderful day.